Good morning. My name is Ashley Craiglow. My pronouns are she, her, hers, and I would like to welcome and thank you for joining us for today's session on bridging data and community action. Before we start, I'm going to go over a few housekeeping items. We are excited to announce that today's webinar will be accessible to a wider audience. We have arranged for an American Sign Language interpreter who will be present throughout the entire session. Additionally, we are recording the entire webinar with ASL interpretation. The recordings will be available on our YouTube channel for later viewing. Whether you attend the live session or catch up later, you will have the opportunity to engage with the material in a way that suits your needs. I encourage you to subscribe to our channel so that you can keep up with the latest additions to our video library. We are also always looking for suggestions for future webinar topics. If you have any suggestions for topics or speakers, feel free to send those to me at my email, which I will share in the chat. Please keep your microphone set to mute. Just a note, if you experience any issues with your bandwidth or audio quality, it often helps to disable your camera. If you'd like, you can enter your first name and organization or community that you're from in the chat box, and what you are hoping to get out of today's session and how you found out about the webinar. If you have any questions during today's session, please feel free to enter your question into the chat and we'll address them at the end of the presentation. We will also take any additional questions at that time. At the close of today's session, we will have a quick evaluation on today's session pop up in your browser. Please take a moment and complete the survey. It helps us greatly when planning for future sessions. One last quick reminder, please visit our Facebook page for more information on other upcoming sessions. And you can also check out our website at arrowheadaging.org. So a little bit about the Arrowhead Regional Development Commission. We are designated by the Minnesota Board on Aging as the area agency on aging for the planning and service area under the authority of Title III of the Older Americans Act. The Arrowhead Agency on Aging is committed to helping older adults maintain their highest level of independence. Area agencies on aging are regional organizations that provide the services, supports, and information for just about everything that older adults and their families can need. Minnesota has 7 AAAs across the state that are local connections to older Minnesotans and the community support they need as they age. The Arrowhead Area Agency on Aging's planning and service area are designated by the Minnesota Board on Aging, including the counties Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis. Now I'm going to take a moment to read our Arrowhead Area Agency on Aging land acknowledgement. As we support our mission to help older adults maintain their highest level of independence, we do this while being respectful of the space we are being welcomed into by Indigenous people. We strive to deepen our understanding of the multiple ways in which people see and understand land and acknowledge the Indigenous people who have relationships with this land. We also acknowledge the decades of historical trauma, loss, and grief experienced by Indigenous people. It is our promise not only to recognize these truths, but also take action to show support of our Indigenous elders, neighbors, and friends, and understand our place within the past, present, and future of this land. We know this is just one step in recognizing and honoring the sovereignty of tribal nations. So we are honored to be joined by today's presenters, Jess Langer, Gina Marcella, and Brenda Schaefer-Palanin. We are so thankful that you are all here with us today, and I am going to now turn things over to Jess to start us off.
All right, good morning. My name is Jess Langer. I'm a Community Outreach Specialist with the Arrowhead Area Agency on Aging. To promote accessibility and inclusivity in our space today, I'm going to share my pronouns and give a short self-description. I use she, they pronouns. I have long brown hair. I'm wearing clear frames and a gray and white striped shirt and a yellow sweater. And I want to welcome you to today's webinar, Bridging Data and Community Action. We can go on to the next slide. So today I'm excited to share about our county profile project and the information that these profiles contain. The agenda for our time together is first to share this resource with you, show you where you can access the profiles, the report, and sources, and then walk through the data on the state, regional, and county profiles. Then I'll hand it off to our development staff, Gina and Brenda, to explore federal resources under the Older Americans Act and tap into state and regional funding options as well. We hope you leave this webinar feeling empowered to utilize the data on the profiles to tell the stories of your county, region, and state, and inspired to seek out funding to support gap areas that may be highlighted by the data. Next slide. So first, we're going to talk about where to find these profiles, but before that, I just want to give a little bit of context. These profiles are intended to show a snapshot of the health and well-being of the Arrowhead region, the counties that make up this region, and the state of Minnesota as a whole. We hope these profiles can be used as a resource to create systems change so all people in the Arrowhead region have the opportunity to attain their highest potential for health and well-being and maintain their highest level of independence. The information for this project was gathered from various trusted sources, such as the U.S. Census Bureau, Centers for Disease Control, U.S. Department of Agriculture, Bridge to Health Survey, County Health Rankings and Roadmaps, a program of the University of Wisconsin Population Health Institute, AEOA, Minnesota Broadband Map, and state demographers. Links to these sources can be found in the appendix of the report, and the report, as well as all 10 profiles, can be found on and downloaded from our website at arrowheadaging.org/county profile, county-profile, and I'll put that in the chat too so you can access that, and it's also on your screen. In the report, you will find further context about the project, more information about the Quad A, definitions for terms used in the profiles, and our data sources. The geographic area analyzed for this project includes the 7 counties in the Arrowhead region: Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis. This project was funded through St. Louis County Public Health and the Administration for Community Living. So before we dive into the profiles, I want to give some context as to why we chose the data points that we did. As part of the process, a preliminary report was presented to our partners for input. Using their insights, we determined what data would be most useful for processes related to community development, funding, and decision-making. Since Older American Act funds are used specifically for those 60 plus rather than the standard 65 plus, we decided to work with a state demographer to obtain data for the 60 plus age group in all possible areas. It was not possible to separate into 60 plus for all of our topic areas, but we felt it was still important to offer the picture provided by those metrics, whether at 18 plus or 65 plus. The goal was to include basic demographics data as well as data most relevant to our target populations and audiences, which are older adults 60 plus and those serving those older adults. Next slide. So first we'll go through the state profile. On the right-hand side of our screen, we have what our full profiles look like. They're set up as an infographic, but for the sake of a presentation, we'll be going through them chunk by chunk. Next slide. So these first 3 metrics are going to be present on all 10 profiles, and were all gathered from the U.S. Census Bureau. The total population data comes from the U.S. Census Bureau's 2023 Quick Facts, and the 60 plus population and below poverty level 60 plus come from the 2021 American Community Survey, and the living alone 60 plus and veterans 60 plus data comes from the 2019 American Community Survey. So in Minnesota, you can see that our total population is 5,717,184. Our total 60 plus population is 1,211,547, or 21.2% of the total population. And our veteran 60 plus population is 197,482, or 16.3% of the total population. In Minnesota, 7.3% or 88,443 of our 60+ individuals have incomes that are below poverty level, and 41.5% or 502,792 60+ individuals live alone in Minnesota. Next slide. So next we have health disparities for individuals 18+. These numbers are by percent of total population and are comparing the Arrowhead region's percentages to the state of Minnesota's. And just a quick note here, since this data set is comparing the Arrowhead to Minnesota, and our subsequent profiles also compare to Minnesota, we won't be going through this section when we go through the regional profile because it would be the same data. So our sources for data here are the 2020 Bridge to Health survey, where we extracted data for diabetes, high blood pressure, and high cholesterol prevalence, and the County Health Rankings and Roadmaps 2023 rankings for the rest of the data points. So going through that data now, we see that diabetes prevalence in the Arrowhead region is higher than Minnesota at 13% compared to 9% prevalence. High blood pressure prevalence in the Arrowhead is also higher at a rate of 43%, where Minnesota sees 39%, 29%. And lastly, high cholesterol is higher in the Arrowhead than in Minnesota at 32% versus 30%. For folks indicating that their health is poor or fair, we have 12% in the Arrowhead versus 10% statewide. For broadband access, the Arrowhead shows 84% with access versus statewide, where 89% have access. And 10% in the Arrowhead live with food insecurity versus 6% statewide, and 7% in the Arrowhead are uninsured versus statewide, where 6% are uninsured. Next slide. So here we are looking at statewide race and ethnicity for individuals 60+, and the most vulnerable in disaster, otherwise known as the Social Vulnerability Index, which accounts for all ages. Race and ethnicity is pretty straightforward. We got this data from the U.S. Census Bureau's 2019 American Community Survey. The Social Vulnerability Index, or SVI, is a tool from the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry, which are subsidiaries of the U.S. Department of Health and Human Services. So first, let's define social vulnerability. The CDC defines social vulnerability as, quote, poverty, lack of access to transportation, and crowded housing, which may weaken a community's ability to prevent human suffering and financial loss in a disaster, end quote. The SVI, the Social Vulnerability Index, was created, quote, to help public health officials and emergency response planners identify and map the communities that will most likely need support before, during, and after a hazardous event, end quote. The Social Vulnerability Index represents the vulnerability of U.S. Census tracts, counties, and states. It, quote, ranks the tracts on 16 factors, including unemployment, racial and ethnic minority status, and disability, and further groups them into 4 related themes. Next slide. So those variables are shown here, and this graphic, along with other definitions such as broadband access, food insecurity, and poor or fair health, can be found in the definitions section of the report. And just another reminder here, if you find yourself wanting to take a look at these data sources or read through any definitions again, as I mentioned earlier, you can find these in the report that can be found on our website, arrowheadaging.org/county-profile, and that link is in the chat. So now back to the previous slide, please. So now that we have some context for our data, let's go through it. In the state of Minnesota, we have a 60+ population that identifies as 92.8% white, 2.5% Black or African American, 2.1% Asian alone, 0% Native Hawaiian or Pacific Islander, 0.6% American Indian or Alaska Native, 1.4% Hispanic or Latino, and 0.6% 2 or more races. The Social Vulnerability Index is color-coded has color-coded counties in Minnesota, and those that have a low level of vulnerability are indicated with a light yellow color. Low medium level of vulnerability are indicated with the light green color. Medium high levels are indicated with the teal color, and the high levels of vulnerability are indicated with the darker blue color. So you can see that in Minnesota, there is quite a range. Looking at the Arrowhead region, 5 out of 7 of our counties show medium high levels of vulnerability. And looking at greater Minnesota, there are quite a few counties with high levels of vulnerability. In specific, 22 out of 87 counties have high levels of vulnerability. It's also very evenly split, with 22 counties with medium high levels, 21 with low medium levels, and 22 with low levels of vulnerability. So it's just kind of interesting how evenly split the counties are throughout the state. Also, I want to note here that this map is going to look different than the map shown on the Arrowhead regional profile. This map you're seeing here is the statewide comparison. So each county is being compared to the other within the state. But the map shown on the regional profile that we'll see in a little bit shows the Arrowhead counties as compared to nationwide data. If you're curious as to how Minnesota compares nationwide, I would encourage you to visit Appendix A in the report and click on the data source for the Social Vulnerability Index. This will take you to the page where you can find data, documentation, and also access the interactive map where these images are from. Next slide, please. Oh, and one more, thanks. So here we have low vehicle access for those 18 plus and suicide data for individuals 18 plus in the Arrowhead region versus the state of Minnesota. So the low vehicle access data comes from the USDA's Economic Research Service Food Access Research Atlas tool. Low vehicle access is defined by the USDA as, quote, tracts in which more than 100 households have no access to a vehicle and are more than half mile from the nearest supermarket, or a significant number of share of residents are more than 20 miles from the nearest supermarket, end quote. The suicide data comes from the CDC's National Center for Health Statistics National Vital Statistics System, mortality 1999 to 2020 on the CDC Wonder online database. And this was released in 2021. So looking at our low vehicle access map, I just want to highlight a few things. Within the Arrowhead region, we can see that most of Cook County, lots of western and southwestern Koochiching County, and a portion of southwest St. Louis County are indicating low vehicle access. And then there are spots within Aiken, Carlton, Itasca, Lake, and St. Louis that are also indicating low vehicle access. And to reiterate, these are shown by census tracts. So in Cook County, that large portion that's colored in that denotes low vehicle access is all one census tract. Looking now at our suicide data, 18 plus in the Arrowhead versus Minnesota, this graph shows that from 2018 through 2021, the Arrowhead region experienced a higher rate of suicide each year than Minnesota's average for individuals 18 plus. Next slide, please. So now we've gone through the Minnesota state profile. We'll be going through the regional profile. Again, on the right side, that's what that full county profile is going to look like, and we'll be going through it chunk by chunk. Next slide. So in the Arrowhead, our total population is 325,813. Our 60 plus population is 94,482, or 29% of our regional population. Our veteran 18 plus population is 22,511, or 6.9% of our regional population. And you'll notice here that the Arrowhead regional profile and on subsequent county profiles, we were unable to extract 60 plus data for veterans. So you'll be seeing veterans 18 plus going forward. In the Arrowhead region, we have 8.9% or 8,448 60-plus individuals living below poverty level, and we have 26.9% or 25,415 60-plus individuals living alone in the Arrowhead. Next slide. Here we have race and ethnicity 60 plus, and the most vulnerable in disaster, or the social vulnerability index. And we also have language spoken at home for individuals 65 plus. Our language spoken at home data comes from the 2021 American Community Survey. So in the Arrowhead region, we have a 60 plus population that identifies as 96.5% white, 0.4% Black or African American, 0.3% Asian alone, 0% Native Hawaiian or Pacific Islander, 2.1% American Indian or Alaska Native, and 0.5% Hispanic or Latino, and 0.1% identifying as two or more races. As I mentioned earlier, this social vulnerability map looks different than the statewide map since it shows how the Arrowhead region compares on a nationwide level. I think it's interesting to see how levels of vulnerability change when compared to the nation versus the state. And as we can see, those levels of vulnerability went down for a lot of our counties. Now looking at our language spoken at home for individuals 65 plus, we have 97.81% speaking English only, 0.37% speaking Spanish, 0.85% speaking Indo-European languages, 0.17% speaking Asian Islander languages, and 0.78% indicating that they speak a language other than these options that were given on the American Community Survey. Next slide, please. Lastly, on the regional profile, we look at suicide rates for residents aged 60 plus in the Arrowhead. As you can see on the graph, in 2018, individuals less than 60 years had a higher rate of suicide than those that are 60 plus. But in the following years, 2019, 2020, and 2021, our residents aged 60 plus in the Arrowhead had a higher rate of suicide. Next slide. So now we are going to move into our county profiles. And since we want to also connect this data with action and share about some funding sources today, I will only have time to go through one county profile. But I would really encourage you to visit our website and take a look at all 10 of them. It is really interesting to compare and contrast county to county, county to region, county to state, region to state. So I highly encourage you to dive into those profiles, read through the report, check out the data and sources on your own. So we're looking at Aiken County. Again, you can see on the right, that's what that full county profile looks like. Next slide, please. In Aiken County, we have a total population of 15,877, a 60 plus population of 6,684, or 42.1% of the total population in Aiken. We have a veteran 18 plus population of 1,505, or 9.5% of the population. In Aiken, we also have a 10.8%, or 722 60 plus individuals living below poverty level. And we have 23.5%, or 1,570 of our 60 plus individuals living alone in Aiken County. Next slide, please. Looking now at health disparities for individuals 18 plus. Again, this is by percent of total population in Aiken County. We have a diabetes prevalence of 13% versus 9% in Minnesota, a 41% prevalence of high blood pressure compared to 29% in Aiken compared to 41% prevalence compared to 29 in Minnesota. And then a 33% prevalence of high cholesterol in Aiken County versus 30% in Minnesota. We have 13% of individuals indicating poor or fair health compared to 10%. We also have 79% with broadband access in Aiken County versus 89% statewide. And we're also seeing 11% of individuals indicating that they are food insecure compared to 6% statewide, and 7% of individuals in Aiken County are uninsured compared to 6% statewide. Next slide, please. Now we have our Older Americans Act Title III-C Rural Meal Distributions Map. This map was provided by AEOA, the Arrowhead Economic Opportunity Agency, one of our partners, where the data was collected in-house and they mapped out meal distribution centers. So this includes senior dining meals at community dining sites, local restaurants, as well as delivering meals on wheels for folks at home. We also have our county-specific social vulnerability index, or our most vulnerable in disaster, and this is showing levels of vulnerability by census tract. So as you can see, we have high, medium high, and low medium levels in Aiken County. Next slide, please. So lastly, on this profile, we have a broadband access map and race ethnicity 60+ in Aiken County. This broadband access map is from the Minnesota Broadband Map tool from the State of Minnesota Employment and Economic Development Office of Broadband Development. This map is showing unserved and underserved locations. And as you can see in the legend on the right, the red circles and squares are denoting our unserved wire lines, meaning that these lines are receiving less than 25 megabits per second or 3 megabits per second. And the yellow circles and squares are denoting underserved locations, meaning they get less than or equal to 25 megabits per second to less than 100 megabits per second. So since this is a capture of an interactive map, and our profiles are only providing a snapshot of the vast amount of data that goes into asset mapping. Again, I highly encourage you to read the report, find that Appendix A, and visit these sources to really explore the tools and dig into the data more on your own. As for race and ethnicity, for 60+ individuals in Aiken County, we have 98.1% identifying as white alone, 0.1% identifying as Black or African American, 1.3% identifying as American Indian or Alaska Native, 0.4% identifying as Hispanic or Latino, and 0.1% identifying as 2 or more races. And you may notice here that some of the previous identities have been omitted. If these identities are not listed on a county profile, that means that 0% of individuals identified with that race and ethnicity. And what you see on this county profile will be the same on all of the subsequent county profiles, with the exception of our St. Louis County without Duluth. We tried to make that more northern St. Louis County, or St. Louis County without the city of Duluth specific. So those numbers of population, veterans 18+, those are all going to be without Duluth. And next slide. That is all I have for you. Thank you so much. If you have any questions or comments, feel free to put them in the chat or reach out to me after. And again, you can view the profiles and report at arrowheadaging.org/county-profile.
Hi, my name is Gina Marsala, and I use she, her pronouns, and I am one of our Older Americans Act Title III Grants and Contracts Managers. And today I'll be doing an overview of their Title III Older Americans Act funds and how we use them in the Arrowhead region. Next slide, please. So to start off, I'm going to give a little history of the Older Americans Act. So Congress passed the Older Americans Act in 1965 in response to concerns by policymakers about a lack of community social services for older persons. It aimed to providing comprehensive services for older adults with funding based primarily on the percentage of an area's population 60 and older. The act authorized grants to states for community planning and social services, research and development projects, and personnel training in the field of aging. The law also established the Administration on Aging and to administer the newly created grant programs and to serve as a federal focal point on matters concerning older persons. The Administration on Aging is now the Administration for Community Living. And throughout, I'll probably be saying ACL, and that is for the Administration for Community Living. Next slide, please. All right, so the Aging Network, so that provides funding for nutrition and supportive home and community-based services, disease prevention, health promotion services, elder rights programs, national family caregiver support programs, and Native American caregiver support programs. So this slide shows how it gets from the federal level to people in the community. In the previous slide, we mentioned that ACL was appointed to administer the Older Americans Act. So you can see that they're at the top at the federal level, and then it moves down to the state. And in Minnesota, we have the Minnesota Board on Aging. And then in every state, there are area agencies on aging. And in Minnesota, there are 6. And then at the local level, there are regional home and community-based service providers who serve the older adults that are living in the community. Next slide. And here is a map that shows the 6 different area agencies on aging in our state. And you can see that we are the darker green color, so we serve the 7 counties in the northeastern part of the state. Next slide. So under the Older Americans Act, there are 7 different titles. So Title I is Declaration of Objectives. Title II is Administration on Aging. Title III is Grants for States and Community Programs on Aging. Title IV is Activities for Health, Longevity, and Independence. Title V is Community Services for Senior Opportunity Act. Title VI is Grants for Native Americans. Title VII is Vulnerable Elders Rights Protection Activities. And at the Area Agency on Aging, we work with the Title III. Next slide. So Title III, Older Americans Act funds help older Americans live at home and in their community with dignity and independence for as long as possible. Next slide. All right, so our Older Americans Act funding stream. So there are 3, so under Title III, there are 4 categories, and you can see that it's Title 3B, C, D, and E. So for B, it's supportive services. So that's information assistance, legal education, legal assistance, homemaker, chore, assisted transportation, and consultation. There are others, but these are the most popular ones that we see in the Arrowhead. Title 3C is our nutrition services. So that is home delivered meals and congregate meals. Congregate meals are like at a dining site, usually at like a senior center. And home delivered meals are known as Meals on Wheels. Our Title 3D is disease prevention and health promotion. So that is our falls prevention programs like Matter of Balance, Tai Chi Quan, our SAIL, and then our diabetes, our health promotion programs. So that could be a chronic disease self-management program, our diabetes prevention program, and then chronic pain self-management. There are other evidence-based health promotion programs that fall under Title 3D, but these are, again, one of our most popular ones. And then Title 3E, caregiver support services. That is respite services, caregiver counseling, support groups, caregiver information and events, and supplemental services. Next slide. So under these three are under the Title III categories, there are organizations that offer these services. And you can see the organizations that are listed under each title. And some organizations offer services in multiple categories. As you can see, Elder Circle on there, they offer Title III B, D, and E services. But some organizations may just offer one service. Next slide, please. And on this slide, it's just a graphic that shows our Title III funded organizations and where they're located in the Arrowhead region. And then on the left side, there are the region-wide partners. So you can see like AEOA, our legal aid services, and then Lighthouse Center. So they're not on the map, but they serve the whole region. Next slide, please. All right, so to be eligible to receive services that are Title III funded, you must be 60 plus or caregiving for a person that is 60 plus. We do have targeted populations. The targets are for person 60 plus with greatest economic need and social need, with an emphasis on low-income minority individuals, low-income individuals, older adults residing in rural areas, and frail individuals. And then for caregiver services, we have targeted to serve caregivers for persons 60 plus in greatest need, with an emphasis on low-income minority populations and caregivers for persons with Alzheimer's disease and related dementia, regardless of age. And then our Older Americans Act funds usually help individuals that have incomes that do not qualify for waiver services, but then don't make enough to private pay for services. So we kind of usually hit those folks that are kind of right in the middle. Next slide, please. And then for our Title III grants, we are on a 3-year grant cycle. So our first year is a competitive round where we welcome new organizations to apply. The new grant awards are selected in the fall of the prior year. And then the next 2 following years are invite only from the grants that were selected that first year in that competitive round. Our next competitive round will start in 2026, but applications will be available in August of 2025. So if your organization is interested in having Title III funds, that will be when our next competitive round is available. And yeah, so, and if you have any questions on Title III services or interested in possibly applying or how services can be offered in your area, you can always reach out to me or Rebecca Sash, our other Title III grants manager. But that is all I have, and I will pass it on to Brenda.
Thank you, Gina. My name is Brenda Schaefer-Pellenin. I am, description, I am a white cis woman in my late 40s with short, wavy reddish hair. My pronouns are she and her. And I am a planner with on the development team at the Area Agency on Aging, working primarily under the Elder Care Development Partnership Program, which is a grant from the Department of Human Services in the state of Minnesota. So what is EDP? We love to throw our acronyms around in health and human services, but the EDP, Elder Care Development Partnership Program, is a multi-state strategy that was enacted in 1992 to help really prepare our state for the changing demographics and the growing needs of an enlarging older population. And so through our EDP strategies, we work with service providers, local governments, and other partners to really explore and develop innovative programs, pilot system changes, and utilize technology and informal resources to meet the growing and changing needs. And so our team provides technical assistance for agencies and community collaboratives who are seeking funding to support their services, and strategies including the Minnesota Department of Human Services and Minnesota Board on Aging grant funds. So next slide. So some key aspects of that program, and we'll get a little bit further into what we actually do and how we can be a resource to you. But our program operates through regional partnerships across the state, each serving specific counties. For example, the EDP team here in the Arrowhead serves Aiken County, Carlton County, Cook, Itasca, Koochiching, Lake, and St. Louis counties. And we provide technical assistance year-round to local providers. This includes working with public and private long-term services and support providers to collaboratively develop sustainable proposals for systems change. We also work to help expand and strengthen the capacity of those home and community-based service providers. That includes assisting local providers in maximizing the impact of supports and services in the community, as well as such as family caregivers, neighbors, volunteers, peer support, and helping to expand their capacity to serve older adults in their community. We also employ risk management strategies. This is through doing screening process, helping to promote risk management strategies to strengthen the capacity to identify high-risk older adults and or family caregivers, and help target proven risk management interventions with those organizations. And lastly, we do work with the Live Well at Home and the Minnesota Board on Aging's dementia grant applications. We have a specific responsibility to assist and advise interested parties with the Live Well at Home and dementia grant applications. Next slide. Next slide. There we go. So in the past, the work of EDP has largely been guided by the gaps analysis that was done by the states, which helped to identify service gaps in each region of the states. The current iteration of this process is called the Addressing Gaps Initiative. And so that really has kind of shifted that focus to improving access by connecting existing services and recognizing opportunities in the community. As you might guess, and we are not unlike other regions of the state in that our gaps don't change substantially, because they are big, drinking from the fire hose, huge areas of need in our region that we'll keep taking and chipping away at, but they're big areas such as chore services, crisis stabilization, which in our area we have used to do work under COVID, or we do work with organizations serving individuals who are experiencing housing insecurity or homelessness. We do work under mental health and things like that as well under that, and respite and caregiver work. Another area is housing. That's across the board. Every community you talk to, they are in need of housing for older adults. More options across the spectrum of housing, from independent housing for seniors all the way to memory care and skilled nursing facilities, and pretty much everything along the way. Transportation is not something that's limited to older adults. That is a great need throughout the region and has consequences for individuals being able to connect with medical services, being able to get out and get groceries, being able to connect in the community and take advantage of community programming. And then workforce development, which we kind of define as both healthcare and long-term care workforce, as well as older adults actually in the workforce, and as part of our strategies for addressing challenges to the workforce, as well as supporting working caregivers. We have more and more people who are caregiving for a family member who are in the workforce. And many of them are, I'm sure you've heard the term thrown around, sandwich generation. They were just talking about it this morning on the CBS News, talking about those folks who are like myself, who are raising kids and at the same time are taking on more and more responsibilities, perhaps with an older family member as well. So, next slide. So what is a technical assistance? The Area Agency on Aging, our Elder Care Development Partnership staff is available to provide technical assistance to applicants for that Live Well at Home and MBA dementia grants. That consultation can focus on project need and design, outcomes, looking at sustainability, budget, as well as doing reviews of those draft proposals and making some suggestions for ways to maybe strengthen different areas of that application before submitting. The applicants are really strongly encouraged to contact an EDP team member for assistance as early as possible to make sure that we're able to help out. Next slide. So we're going to talk a little bit about those two grants that I mentioned. One of them is the Minnesota Department of Human Services Live Well at Home grant. The current round of applications is closed on that, but we do have a grant cycle each year for that grant. And those grants are intended to help to expand the capacity of long-term services and supports to help people age 65 and older stay in their homes and their communities of choice, to help improve chronic disease management in Minnesota's communities, to expand long-term services and support capacity by linking formal and informal services, and to support caregivers and promote independence through market-based solutions. So just to give you an example, we can, if you're interested in learning more about any of the projects, I'm happy to share information on that. But right now we've got in current grantees in the Arrowhead include the Access North Center for Independent Living, which does home modifications and does some technology, Age Well Arrowhead of Duluth, Aiken County Care, Angels of McGregor, Cook County Public Health, which is doing some transportation innovation with a shared vehicle, Elder Circle in Grand Rapids, North Shore Area Partners, and here in my backyard, Volunteer Services of Carlton County. So those are some of the projects that are right now currently funded under that grant. But as I mentioned, that round of applications for this year is just closed, and so we expect over the next few months we'll have a new round of grantees that will be helping to support and those projects that they're moving forward. Next slide. And the Minnesota Board on Aging Dementia Grants. The current application round on those close this Friday. And those grants are intended to increase awareness of Alzheimer's disease and other dementias, promote the benefits of screening for early identification of dementias, increase the rate of cognitive testing in populations at risk for dementias, and connecting family and friends and neighbors who are caregiving to education, support, and resources. And we have our current grantee in the region. We haven't had a lot of applicants out of our region, and I really would love to see that increase. So if you've got an idea that fits into those categories, we'd love to talk with you. But the current grantee is Couchiching Aging Options, and they are working to extend awareness countywide through dementia-friendly community initiative campaign with a memory cafe as well, and one-to-one support from a dementia care specialist, and then expanding regional connections with social service and healthcare providers. So some really interesting, really fun, interesting and important things happening with those funds. Next slide. So other funding sources. The Elder Care Development Partnership Program staff are also available to help your organization look at other funding sources to support services and programming targeted towards older adults. Really, if you have an idea or a project and you need assistance to help make it happen, please contact us and we can help you with brainstorming, connecting you to other partners, other resources. These funding sources might be things that are national, like AARP does some age-friendly grants. It might be Minnesota-specific grants, or it might be something regional. EDP staff, we regularly share information regarding funding opportunities, and we operate a Basecamp page where we share information about these funding opportunities as well as other educational opportunities. And so if you're interested in that, please reach out to one of us and we can make sure we get you on that Basecamp page so that you can have ready access to that information. Next slide. So just our contact information, myself, my colleague, Ashley Craiglow, and Kimberly Scanlon is also on the call here. You can feel free to reach out to there's no wrong door. You can feel free to reach out to any one of us. We do, like I mentioned, we serve Aiken, Carlson, Cook, Itasca, Koochiching Lake, and St. Louis counties. And we are happy to, it doesn't have to be something that is a Live Well at Home grant. It doesn't have to be something that is a dementia grant. If you've just got something that you're working on that would benefit older adults and you are looking for partners and resources and just someone, a friendly face, a friendly conversation about your idea, please reach out to us. We really want to help you be a success and help make things happen. So, and I will turn things back over to our host, Ashley.
Thank you. Well, I would just like to thank Jess and Gina and Brenda for presenting their information today. I didn't see any questions in the chat, but if anybody has any questions, feel free to put them in there or reply to the emails about the webinar that you got. That is my direct email, and I will connect you to whoever the question pertains to. I did just want to touch on the webinars that we have coming up. We have one tomorrow at noon on returnships, a toolkit to build a multi-generation workforce. And then we also have one coming up in May on the 14th at noon on transportation equity solutions for all. And you can find those on any of our social medias. You can check us out on Facebook, or again, our website is www.arrowheadaging.org. I just want to thank you all for being a part of the webinar today, and I hope you guys have a great rest of your day.